What's up, guys? Tony here. So I want to answer this question. Came in on my Facebook feed. My phone's about to fall over. But I figured the easiest way for me to answer it is just to go ahead and jump on YouTube Live. So let me read the question and then I'll kind of explain. So this is from a therapist who was treating a Medicare Part B beneficiary. And he said the patient ended up signing up for a Humana PPO plan starting January 1st. He was in the hospital through the new year. His wife, they switched plans. Prior to switching, this particular patient had Medicare Part B with AARP Supplemental Plan F. So the question is, well, the statement was they're still paying for Plan F. They can't be. They can't have switched to a Medicare replacement plan and still have a traditional supplemental plan in place. So I'm not sure what they think they're paying for, but they're not paying for Medicare supplemental plan. It's illegal for anyone to sell a Medicare Advantage plan with a traditional Medicare supplemental or Medigap. They might have a different insurance, but it's not a supplemental plan. So your question goes on, says, it's a Humana PPO plan, 50% out-of-network coverage, 50% co-insurance to the patient. Right now it's April 6th. So I'm not sure how far back those dates of services are going. I'm not sure what the timely filing limit is for your Humana plan locally. Since you are out of network, there might be a 12-month timely filing limit, but you would have to find that out. You were asking if the Plan F is going to cover the 50%. I'm going to tell you that the supplemental plan is not going to kick in. It's not going to cover anything because it's not an active policy. So when you switch from traditional Medicare Part B to Medicare Advantage, you do not have a supplemental plan anymore. So in this case, the Medicare beneficiary is a Medicare Advantage beneficiary. You're going to submit claims if you choose to. You're not required to. There's no mandatory claim submission for Medicare Advantage. But if you do, you would submit the claim. You don't know, at least based on your message, if there's a deductible. You don't know what the allowed amount is. So you know it's 50%, probably going to be based on the Medicare Part B allowed amount, but you're not totally guaranteed or sure what that's going to be. So your best case is to talk to the consumer, get a sense for where they are, get a sense for what they can afford and what you can do. And unfortunately, this is one of those situations where you didn't know what was happening, so you're going to have to retroactively kind of put a plan together and do something that is in the best interest of the patient, in the best interest of you as a private practice owner. But I would tell you that if you do choose to submit claims to the Humana PPO plan, or if your patient chooses to submit claims, it's going to process based on the Humana allowed amount, and there likely is no secondary insurance for you to count on. It's unfortunate, but this is kind of one of the pitfalls for the way insurance plans work, and you have to be aware of that. And you always have to, one way to do this is verify all of your payers on the new year, because it's not the first time that I've heard of patients switching and not even realizing that they switched insurance at the new year. So we try to go in and verify all of our patient status with the third-party payer we have on file. I hope that answers your question. You're probably going to have to come to some sort of payment arrangement with this particular patient that can satisfy them and keep you solvent. Thanks for asking the question. If anybody else wants to ask a question, go ahead and throw it in the comments. Join my Facebook group. Find a way to get your questions answered, because we all want to find the answers to the questions we have. I'll catch you guys on the next video.